Welcome to the BrainShape Podcast, hosted by Dr. Andrea Wilkinson, a show where we cut through the noise of the ever-growing, ever-changing world of brain health. What works and what doesn't, what's fact and what's fiction. We look at tips, tools, and techniques backed up by real scientific studies to help you keep your brain healthy and hopefully have some fun along the way. Now, here's your host, Dr. Andrea Wilkinson.
You're listening to the BrainShape Podcast, episode number 24. Our gut and our brain are inextricably linked. What we eat and drink affects our bodies, our brains, our mood, and our risk of disease. Your brain and your gut are physically connected via your spine and your vagus nerve, but your gut and your brain are also in constant and regular communication with each other. Did you know that around 90% of your body's serotonin, the chemical responsible for impacting anxiety, happiness, and mood, is made in your gut? Serotonin not only impacts mood, but also plays a role in sleep, a very important component of healthy aging. Today we're talking with Doug Cook, a registered dietitian nutritionist and the gut brain guy. Doug has 20 years of experience and believes that health is the greatest wealth. Here we go. Here's Doug Cook. Hi, Doug. Thank you so much for joining me on the podcast today.
Thanks for having me on. It's my pleasure.
I'm super excited to talk to you and to learn all about this gut-brain connection. So I'm wondering if you can maybe start off by telling the listeners a little bit about yourself and your history. So how is it that you became interested in the sort of gut-brain health connection?
I just kind of stumbled upon it. In terms of my history, I've always loved health, and I grew up in the kitchen with my mom and grandmother, so I love food, and I just kind of brought that together because I also love science, and I've kind of stumbled through, without any real intention, throughout my career, working in kidney disease, nephrology, diabetes, and it wasn't until I started working at my current job at the Center for Addiction and Mental Health, and just to be clear, I'm not wearing that hat, so I'm not speaking on their behalf by any means. Mm-hmm. But there I started, my first position was specifically working in the medical detox unit, which is the medical supervision of withdrawal from substances, whether it's prescription medication or street drugs. And then I also worked in their rehab program. So it was really through that experience that I really started to understand the impact primarily of drugs, medications, that type of thing on the gut, but then quickly learned how that's inextricably linked to the brain and mental health, and how gut and mental health issues are often concurrent or coexisting, and it's kind of just stemmed from there.
Wow, that's so interesting. And so I'm wondering if you can talk to us about the gut-brain connection. So what is the gut-brain connection?
In simple terms, the gut-brain connection is, I say nothing more, because it's very complex, but it really is simply a literal connection between the brain, the central nervous system, which includes the spinal cord, and the digestive tract. So it's both a physical connection, because there's a nerve called the vagus nerve that travels from the brain into the digestive tract, but there's also a biochemical connection. So both the brain and the gut are producing various chemicals that it uses for communication. Most people have heard of the word neurotransmitters. And so they're inextricably linked back and forth. And the way I look at it, I just treat it as one entity, even though people might come to see me for gut health, or people aren't really thinking about their gut if they've got mental health issues, mood disorders. But the way I like to think of it, and what might help the listeners, is that how goes the gut, so too does the brain, and vice versa. So you can't really have the health of one at the expense of the other.
Right. And so a lot of our neurotransmitters, which you mentioned, those are our brain chemicals. As far as I understand it, and maybe you could just speak a little bit to this, a lot of those chemicals are actually produced in the gut?
Yeah, there's dozens and dozens and dozens of neurotransmitters. The ones that we talk about in mental health, only because we have drugs that affect their metabolism, are things like serotonin and dopamine and norepinephrine. And a lot of them are produced in the gut. Like serotonin, 90%, some people say it's 90, some people say it's 80% of the serotonin is produced in the digestive tract. 50% of the dopamine is believed to be produced there as well. And then there's cannabinoids and acetylcholine and a whole bunch of different ones. So, and then it really goes up and regulates the brain in that way.
If it's produced in our gut, are the foods and whatever we're consuming directly impact their production?
Yes. They are the quality of our diet, the foods that we eat, for sure, directly impacts it because it will provide building blocks for the neurotransmitters. All neurotransmitters are basically made from amino acids, which come from the digestion or the breakdown of dietary protein. But they also are influenced based on, as a result of, rather, how our dietary choices influence our gut health, and that in turn will influence the activity of the gut, which does have an impact on neurotransmitter production and regulation.
Right. Okay. And so why is it that we talk about gut health instead of digestive health?
I think it's just they're used interchangeably. People appreciate the gut, like my gut's killing me, and I've got a pit in my gut. The digestive tract is a little more comprehensive. It's everything from nose to tail, so mouth, esophagus, stomach, the organs that are involved in digestion, like the liver, pancreas, the gallbladder, intestines, etc. But usually when people think about gut, they're really talking about everything from the stomach downwards. So if they have digestive issues, they talk about their gut killing them. It's kind of in the small intestine and maybe the bowel. So it's just a matter of kind of being a bit, not lazy, but in language, we kind of interchange these things all the time. Some are for more technical jargon and some are more everyday language. So,
right.
Yeah, it's a small distinction, but you're right. It really is digestive health. But yeah, I think it's just a matter of interchanging the two.
Right. Wonderful. Can you tell us a little bit about the scientific evidence that supports the idea that food and nutrition can affect the health of our gut, nourish our brain, so it actually impacts our brain function, and improve mood and mental well-being? Yes. What does the research tell us?
Yeah, so that's a big question. So I'll just kind of break it down to the best that I can. So in terms of food and nutrition's impact on the health of our gut, so it's kind of a vague term. Gut health is it's not defined. It's not been really quantified. It's semi-qualified, I guess is the word. It's showing up everywhere. It's showing up in the scientific literature. It's showing up in everyday language. But when we talk about gut health, kind of generically speaking, we're really looking at kind of 5 domains, and diet does impact all of these. So big picture, you're looking at the effective digestion and absorption of the food and therefore the nutrients that we eat. Gut health would include good gut health would include the absence of gastrointestinal or digestive tract illnesses. The microbiota is the real darling of the day, so ensuring that we have a normal and stable microbiota lends itself to gut health. The immune system, about 70% of the immune system is in the digestive tract, so having a robust immunity will impact positively on gut health, and all of this is going to influence the state of well-being. So what we eat and drink really does affect all of those domains. It's a little beyond the scope of just this quick interview or conversation, but the quality of the choices, the nutrient density of those food choices will all influence those domains to some degree. So I can drill down a little more on that if you want before I kind of go to the brain.
Yeah, I would love that.
Yeah, so, when you think about effective digestion, you're going to want to eat foods that are going to support nutritional health, but are also not, that are in line with everyone's personal tolerance. So people have different sensitivity to food and food allergies. So that's going to impact the health of the gut. Also in making sure that there's, regular bowel movements, no issues in that regard. Disease goes without saying. So good gut health would be the absence of these diseases, or if there is a syndrome or something that someone has, like inflammatory bowel disease, Crohn's, colitis, or celiac disease, managing those really well so they don't have a negative impact on the gut. The microbiota, we're just scratching the surface. Really, it's just so preliminary, but in terms of how we might be able to manipulate it. However, we do know that what we eat and drink affects the variety of the gut bacteria and the degree of the different populations, or the population base of good versus bad. It's a bit of a simplistic distinction. So all of those, and various nutrients are needed for the immune system. So all of those are going to affect the state of the gut. So again, there I am using that word interchangeably with the digestive tract. So if you've got a happy gut, happy digestive tract, it's going to lend itself to supporting a healthy mood, because not just because the microbiota are going to be happy and healthy, but this health or lack of health, or this happiness or lack of happiness, gets transmitted to the brain via something called the enteric nervous system, or the intrinsic nervous system. So that goes back to the gut-brain axis. So everyone knows the brain is dense with neurons or brain cells, but the gut is as well. It has about 1/1000th the density. So it's the next second largest cluster of neurons outside of the brain, and so it's constantly sending messages back up to the brain, which is going to influence health. So to get back to the original question, the science is, it's so huge and so vast, supporting all of these various domains.
Yeah.
A lot to say.
It's very complicated indeed. And I have heard, and let me know if you've sort of read any literature in the same regard, about the complexity of the bacteria in our gut. We want sort of increased complexity, or having complex gut bacteria is considered good. And is it true that the complexity of our gut bacteria changes as we age?
So there is some flux. It's largely stable. It's usually set by around 3 from what I've read and understood and understand, and it's pretty stable. It's pretty hard to shift it. It's as unique as our fingerprints, apparently, and the degree, we can't really change the residents, or the ones that are there, but we can change the ratios of the ones that are there through diet, or some of the things that we do everyday life works against us in that regard. Where you get some major shifts are things like antibiotics. That for sure can have a lasting impact on the profile of the microbiota. But for sure, things will shift as we get older, and a lot of things affect that, like the stomach acidity just changes in our metabolism, and I'm using that as a broad term, not just burning calories. Medications that we use, and aging affects everything. So there are some shifts.
Yeah, for sure. Because I had read that the complexity of the gut bacteria changes with age, and so I was really thankful.
You're saying it probably becomes less complex, like it becomes less diverse.
That's what I read.
Yeah, I haven't read as much as I read the other stuff, so I'll just I'll go with what you said. But I know there are some changes, and the question, of course, is whether or not that has a meaningful outcome in terms of health, and that I would say for sure we're not clear yet.
Right, exactly. And so, what are the different components that impact gut function?
Yeah, when we think about optimizing gut function, and again, that's kind of a broad term, it goes back to you're not just what you eat, you're what you absorb. So you want to digest your food well, absorb and eliminate efficiently. You want to maintain a healthy gut barrier function and intestinal permeability, and I'll elaborate on that in a second. And as we mentioned, maintain a healthy and robust gut bacteria. And then the other big thing that we're certainly appreciating more so is, as you've mentioned, inflammation of the digestive tract and its impact on immune function and, in turn, neurotransmitter function and production, which is going to affect our mood. So, when I kind of take a kind of a big view, what I try to get people to appreciate, and this is, people need to wrap their heads around this the first time they hear it, is that nothing really goes in the body when we swallow it. So if you think of the digestive tract from mouth to anus, it's really the largest external surface to the body. So it is a tube, if you think about it. So it's a long tube, and the small intestines are kind of, people appreciate that they're kind of convoluted and rippled, if you will. It's not a smooth tube. But it is a large surface area, and only if things get through that if things enter the bloodstream and the lymph system. So what we forget sometimes is out of sight, out of mind. So we'll eat something, we'll drink something, we'll take a certain medication, and then we don't really think about it. But if you think about the lining of your mouth, it's very soft, it's very, it's slippery, it's got a mucous membrane. That's like the entire length of your digestive tract. Unlike the skin that's designed to be quite impermeable, it's got a lot of keratin, the digestive tract is very, very sensitive. So I get people to understand that if you were to use a toner, like some brand of anti-acne toner, and you're overzealous on your forehead or your nose, the skin would dry out, it would crack, etc. So, and it's a little more resilient than the digestive tract. So there's so many things that we can put down the gullet that increase our risk for inflammation, which just sets off this whole kind of cascade of side effects. Not side effects, but there'll be a lot of signaling inflammation is in the body, communicating through the nervous system, et cetera, the enteric nervous system.
Is bloating the same as gut inflammation?
Well, it's hard to separate the two. So gut inflammation can lead to bloating, but bloating is just really a symptom. It's not a diagnosis. So it's, in simple terms, it's just a feeling of increased abdominal pressure from within, feeling of fullness, distension. There's sometimes discomfort and pain. It's not the same as weight gain. So there's usually something that's causing that. Sometimes it's muscular, like people's stomach walls are weak. But if it's something like a food intolerance or a bacterial imbalance or the impact of a drug or a medication or something like alcohol, there's a lot of damage. It can lead to bloating because of a whole bunch of reasons, but they usually track closer than they don't track. So, but that's not to say that everybody with bloating automatically has gut inflammation.
Right. How else would we know if we were experiencing gut inflammation other than the external symptom of bloating?
Well, the only way you would know is through some kind of scope. So, yeah. So they would scope the colon. That's easy. They can scope the first, 8-10 inches of the small intestine, like when they check for celiac disease and that type of stuff, and they can see inflammation. But lower down in the ileum and the jejunum, they're not really, the scopes don't go down that far. So it's kind of assumed or treated empirically. I guess it becomes moot. I mean, if it's inflamed, what can you do? You just kind of try to get to the root cause, and then if the symptoms subside, you can assume there's some healing.
Right. And so, and I guess I'm just trying to understand it for my own personal reasons, to be perfectly honest, but because we know gut inflammation is bad, and without the bloating, I'm just wondering how else someone would know that they were experiencing that.
Well, you couldn't really. I mean, even if you took some blood markers, those are for inflammation. They're not specific. So, I mean, if in a research setting, they can look for something like a particular type of toxin that's produced by a bacteria that's found in the gut. And if those levels are higher above baseline, then they can assume there's some leaky gut or gut-berry dysfunction,
right.
in which case there would be for sure inflammation.
Mm-hmm.
But if somebody has, IBS or celiac, you can assume there's inflammation.
Right.
But for the average person, if they're taking tons of ibuprofen or they're a moderate drinker, there's going to be some degree of inflammation, but it's not something you can necessarily assess just by symptoms, and there's certainly no diagnostic tool.
Right. Can you tell us a little bit about this concept of FODMAP? So this is new to me, and I actually learned about it when I visited your website. And so I'm wondering if you can tell us a little bit about what a FODMAP is, and then what listeners can do to control the amount of FODMAPs in their diet.
Well, FODMAP is an acronym, and it stands for fermentable oligodimmonosaccharides and polyols. So that's just a fancy word
Very fancy.
to describe the different ways carbohydrates are found in the food supply. So there's sugar alcohols, which is a polyol like mannitol or sorbitol, and then sugars are either individual units like glucose and fructose, or they're joined together like disaccharides. There's two of them, such as lactose when you've got glucose and galactose in milk sugar.
Mm-hmm.
And so basically it's just a way to categorize different types of carbohydrate, and they're neither good nor bad. A so-called normal or typical healthy digestive tract can eat a variety of foods, including a variety of these different types of sugars and starches, and digest them without difficulty. So when they get into the large bowel, some of them do get in without being fully broken down in the small intestine, mm-hmm. and the bacteria there ferment them and eat them, and that's what they use for fuel so that they can grow and populate, and their children can have children and so on, and that's all really good. So we'll all ferment them to some degree, and that's what gives us our daily dose of flatulence.
Mm-hmm.
So where FODMAPs can be a problem is if there's various digestive issues where they're getting fermented excessively, which can produce a large amount of gas, which can cause a lot of problems like reflux or bloating, or cause changes in stool, that type of thing. So it's typically seen in things like Crohn's colitis, irritable bowel syndrome, or something called small intestinal bacterial overgrowth, or SIBO for short.
Is that to do with the complexity of a carbohydrate? Because I've been learning a little bit about the simple versus complex carbohydrates.
Yeah, so we still do, I guess. We call sugars that are individual units like glucose, or sugars that are two together like honey, which is fructose, and honey is two monosaccharides, but sucrose, table sugar, which is glucose and fructose together. We used to call those simple because their structure was simple compared to these long chains of sugar units, which we used to call complex.
Mm-hmm.
I think technically it's probably better to call them sugars and starches.
Right.
So sugars are those smaller sugar units, and starches are those longer ones. So it's not necessary. I mean, the complexity can affect it to some degree, but also individual sugars can equally be problematic depending on the person. So you can have fructose maldigestion, and it's a single unit sugar, and it has nothing to do with how many units are attached to it. So it's not that black and white, but
right.
It does play a role to some degree.
So can you help the listener sort of elucidate in their own minds if they need to work on healing their gut? So what are like signs and symptoms that people should be looking for?
Well, it's the typical stuff that people go to the doctor for. So digestive issues, gut issues, are one of the, I don't forget what the statistic is. If it's not in the top two, it's the top three reasons. So everyone burps and everyone passes gas. That's not a problem. It's when these symptoms become really excessive, and I know that's subjective, but when it starts to become problematic, and it interferes with a person's kind of quality of life. So if there's excess flatulence or excess bloating and regurgitation or reflux, these are causes for concern insofar that you need to check them out, not to have anyone panic. If there's persistent or unexplained nausea or vomiting, changes in the bowel habits, so constipation, diarrhea, that type of thing. If any foods are suddenly giving people problems that they didn't otherwise, that might be worth checking out, because it could be an ulcer, who knows what it could be. Right. Anything that has abdominal pain and cramping or unexplained weight loss would be reasons to have these investigated.
And what are some tips and tricks listeners can implement into their own lifestyle that can really impact healing their gut?
Well, what you want to do is, all of us want to do, is basically eat things that are not going to increase the likelihood of causing gut irritation, and that would be, reducing highly processed foods. So it's more than just thinking about poor quality food and lack of vitamins and minerals. So the more refined, the more processed it is, the more devoid it is of the nutrients like vitamins and minerals that are needed for gut health, but also your entire overall health. But you want to make sure you get foods that have different types of fiber to nourish the bacteria. So reducing the processed food, getting more fiber. Also, not to underestimate the impact of many over-the-counter but also prescription medications and their impact on the digestive health and lining of the digestive tract. So if someone's taking prescription medications, of course, take them as prescribed. If there's a way to cut back on them, that's always good. Some of the ones that people don't really think about when it comes specifically to the gut are the so-called NSAIDs, so things like acetylsalicylic acid, or aspirin is the brand, ibuprofen. Those are quite hard on the lining of the digestive tract.
Right.
Alcohol, no one likes to hear that, but alcohol is quite caustic as well. So if you think of rubbing alcohol on your forehead, you could imagine what alcohol is. It can be quite drying. Right. And another big one is stress. So that's the whole gut-brain axis thing. So stress is really can have a real negative impact on the digestive tract.
Yeah, stress is a big one. It's problematic for so many reasons. So can you tell us a little bit about your practice and the services that you offer?
Yeah, so I offer some private practice services. My focus really is on, I'll say gut health because that's what the vernacular is. But I also do mental health, brain health, looking at nourishing the brain for just preserving function, cognitive function, but also reducing the risk for many brain-related diseases that are associated with aging. And as much as people don't like it, I call it anti-aging. People don't like it because it seems to have a negative connotation, but you could think of it as longevity, or really about maximizing quality of life, I guess, as you get older.
Right.
Yeah.
That's wonderful. Thank you so much, Doug, for all of the information that you shared with us today. It was so informative and insightful. I learned so much about the gut-brain connection and all these different nuances. So I really appreciate you taking the time to enlighten me and the listeners. And so if listeners are interested in getting in contact with you to learn more about all of the information that you know, but also some of the services that you provide, where is the best place that they can go to find out more?
The best place would be my website.
Okay.
So that's dougcookrd.com. And then the links to the various social media channels are there, but everything's all the same, whether it's Facebook, Twitter, or Instagram. It's all Doug Cook RD.
Wonderful. Thank you so much, Doug. I really appreciate you taking the time.
You're welcome. Thanks for having me on.
Bye-bye.
Bye-bye.
To learn more about the work that Doug Cook is doing on optimizing the gut-brain connection, you can visit his website at dougcookrd.com. I'll put the link in the show notes. If you've missed any of this, you can dive into the show notes for this episode and all past episodes at www.brainshape.ca/podcast. To access the show notes from today's episode specifically, just type episode 24 in the search bar and today's episode will pop right up. Thank you so much for tuning in. I hope that this episode highlighted the important role that our gut plays in the function of our brain, and that keeping your gut healthy and functioning well has a direct impact on your brain health. Don't forget to subscribe to the podcast so that you'll be notified every time we publish a new episode. And since we're a weekly show, I'll see you back here next week. In the meantime, you can follow me on social media at BrainShapeTO, and be sure to let me know if there are any specific topics that you want me to cover on the podcast. Until next time, keep your brain in shape. And as always, it's been such a pleasure hanging out with you.